Today I'll be going over how to perform a C1-2 rotational manipulation. It is important to use professional judgment when implementing skills and techniques in patient care. Please utilize appropriate procedures to identify relevant precautions and contraindications. Always maintain compliance with your scope of practice. Cervical manipulation should only be performed if no red flags are discovered once obtaining a proper history, taking blood pressure as there is a correlation between high blood pressure and risk of stroke, completing a cranial nerve screen, upper motor neuron testing, and carotid tests in neutral, extension, and rotation, observing the patient's cervical active and passive range of motion with overpressure, and completing ligamentous immobility testing. The cervical flexion rotation test is one way to examine whether or not the patient could benefit from a C1-2 rotational manipulation. To complete this test, you support the patient's head in your hands, fully flex their head, and then rotate their head, comparing bilaterally. A side-to-side difference of 10 degrees or greater is included in the clinical prediction rule for neck pain and manipulation, as well as symptoms less than 38 days, pain with posterior to anterior spring testing of mid-cervical spine, and positive expectations that the manipulation will help. If the patient still meets the criteria to perform cervical manipulation, it is pertinent that you obtain consent. Discuss the clinical issue and nature of the decision to be made, alternative options such as mobilization, the benefits versus the risk, and any uncertainties associated with the decision. Assess the patient's understanding and their preference of treatment. It is important to note that you can acquire the same results with cervical mobilization if you or the patient are not comfortable with the technique. Once consent is obtained, you may begin the C1-C2 AA rotational technique. To begin, you'll need to lock the joint you are trying to manip. Your contact point would be the posterior lateral aspect of the articular pillar over the target vertebrae. Your applicator hand will be the one contralateral to the side that you are trying to improve rotation to. So if you're trying to improve left rotation, your applicator hand will be your right hand. Use the anterior lateral aspect of the MCP of your index finger and place it on C1. Your thumb will be perpendicular to their ear. This placement can vary based on hand size. Just be sure to not apply pressure on the patient's throat if you have smaller hands, as this can be very uncomfortable for the patient. Use your other hand to support their head and use their nose as an access point so that you're rotating their head only in small amounts. I'm going to exaggerate the movements. We're going to extend, side shift away, side bend towards, and rotate away. It is important to note that this movement should be minimal. We will review again, but a little faster this time. Extend, side shift away, side bend towards, and rotate away. If you look in the lower right-hand corner, you can see how I am using the patient's nose as an axis and trying to keep their nose in the center of their body. Now it's your turn to practice. Practice using both of your hands and ask your patient for feedback. Once comfortable with the technique, you can add the thrust. Don't be afraid to play with their neck and get a feel for how it moves. Once you've locked it, apply the small, quick rotational thrust. I want you to practice this technique. If you're not comfortable with using your patient's head, I have found it helpful to use a football to practice and master the small, quick rotation required for this manipulation. After completing the C1-C2 rotational manipulation, perform a cervical flexion and rotation test again to see if you acquired the results you were looking for. Every manipulation should be followed with neuro re-education. You may click the link below to see my tutorial video of manual neuro re-education for C1-C2 rotation.